The way of learning today's topic is heart valve and heart sound and ECG exhibited for staff nurse interns. First one is blood moves from right atrium to right ventricle. Option A aortic valve. Option B tricuspid valve. Option C bicuspid valve. Option D none of these. Correct answer is option B tricuspid valve. Next one is a patient with a tricuspid valve disorder will have impaired blood flow between the option A left atrium and left ventricle, option B right atrium and right ventricle, option C right ventricle and pulmonary artery, option D vena cava and right atrium. Correct answer is option B right atrium and right ventricle. Next one is which one is usually referred to as mitral valve? Option A right atrioventricular valve, option B left atrioventricular valve, option C pulmonic valve, option D aortic valve. Correct answer is option B left atrioventricular valve. Next one is which valve prevent backward flow of blood into the left atrium? Option A aortic valve, option B pulmonary valve, option C tricuspid valve, option D mitral valve. Correct answer is option D mitral valve. Next one is the valve prevents the backflow of blood into the right ventricle when the ventricular valve muscle relaxes. Option A tricuspid valve, option B bicuspid valve, option C pulmonary valve, option D pulmonary artery. Correct answer is option C pulmonary valve. Next one is the amount of resistance to ejection of blood from ventricle is option A preload, option B ejection fraction, option C afterload, option D in diastolic pressure. Correct answer is option C afterload. Next one is the lowest pressure that occurs when the heart is at its resting period just before the contraction of the ventricle is known as option A diastolic pressure, option B hypertension, option C systolic pressure, option D pulse pressure. Correct answer is option A diastolic pressure. Next one is the second heart sound is due to option A aortic valve, option B mitral valve, option C tricuspid valve, option D foramen ovale. Correct answer is option A aortic valve. Next one is the natural pacemaker of the heart is option A bundle of His, option B AB node, option C Purkinje fibers, option D sinoatrial. Correct answer is option D sinoatrial. Next one is primary pacemaker in mammalian heart is option A AB node, option B sinoatrial node, option C Purkinje fiber, option D bundle of His. Correct answer is option B sinoatrial node. Next one is the SA node is situated in option A left atrium, option B right ventricle, option C left ventricle, option D right atrium. Correct answer is option D right atrium. Next one is the AB node is located in the option A right atrium, option B atrioventricular septum, option C pericardium, option D myocardium. Correct answer is option D myocardium. Next one is the priority for a patient within 24 hours after insertion of pacemaker would be to option A maintain skin integrity, option B maintain cardiac conduction stability, option C decrease cardiac output. Option D, increase activity level. Correct answer is option B, maintain cardiac conduction stability. Next one is, what is the total period of one cardiac cycle? Option A, 1.8 seconds. Option B, 0.1 seconds. Option C, 1.2 seconds. Option D, 0.8 seconds. Correct answer is option D, 0.8 seconds. Next one is, electrocardiogram is option A, recording of brain wave activity. Option B, recording of heart activity. Option C, recording of peristalsis. Option D, none of the above. Correct answer is option B, recording of heart activity. Next one is, diagnostic procedure done for heart disease. Option A, EMG. Option B, USG. Option C, ECG. Option D, EEG. Correct answer is option C, ECG. Next one is, in relation to the conduction pathway of the human heart, a normal 12-lead ECG consists of waves known as P, Q, R, S and T. Which wave reflects the atrial depolarization? Option A, U. Option B, T. Option C, P. Option D, QRS. Correct answer is option C, P. Next one is, the P wave on the electrogram represents option A, atrial depolarization. Option B, atrial repolarization. Option C, ventricular depolarization. Option D, ventricular repolarization. Correct answer is option A, atrial depolarization. Next one is, when interpreting ECG, P wave disruption indicates option A, cardiac arrest. Option B, ventricular tachycardia. Option C, atrial fibrillation. Option D, complete block. Correct answer is option C, atrial fibrillation. Next one is, QRS complex occurs due to option A, atrial depolarization. Option B, ventricular depolarization. Option C, ventricular repolarization. Option D, conduction through AV nodes. Correct answer is option B, ventricular depolarization. Next one is, a nurse has performed an ECG. At the time of interpretation, she found that it is a normal sinus rhythm. The normal duration of QRS complex is option A, 0.08 to 0.10 second. Option B, 0.2 to 0.8 second. Option C, 0.8 to 1.2 second. Option D, 1.2 to 2 second. Correct answer is option A, 0.08 to 0.10 second. Next one is, the T wave in ECG graph represents option A, ventricular repolarization. Option B, time needed for sinus node stimulation. Option C, total time for ventricular depolarization. Option D, repolarization of Purkinje fibers. Correct answer is option A, ventricular repolarization. Next one is, which of the following represents lead 3 of electrocardiography? Option A, right leg to right arm. Option B, left leg to left arm. Option C, right leg to left arm. Option D, left leg to right arm. Correct answer is option B, left leg to left arm. Next one is, while doing ECG, 6 electrode is placed in option A, left fourth intercostal space. Option B, right fourth intercostal space. Option C, right fifth intercostal space. Option D, left fifth intercostal space. Correct answer is option B, right fourth intercostal space. Next one is lead V1 and V2 in ECG represents which area of the heart? Option A, inferior wall. Option B, septal wall. Option C, anterior wall. Option D, lateral wall. Correct answer is option B, septal wall. Thanks for watching. Like, comment and subscribe the channel.